Welcome to Physiology class. In this session, we will be discussing about mechanics of respiration. So respiration occurs in two phases and they're inspiration and expiration. As you all know, inspiration is an active process and during this process, there occurs enlargement of thoracic cage as well as lungs so that the air can easily enter into the lungs from the atmosphere. At the same time, expiration is a passive process. During expiration, what happens? The thoracic cage as well as lung will decrease in size and attain the pre-inspiratory position so that the air can easily leave the lungs from the lungs into the atmosphere. So in this video, you can see how the size of thoracic cage as well as lung is getting varied during inspiration and expiration. During inspiration, the size is getting increased and during expiration, it goes back to normal size. Now, whenever mechanics of respiration is discussed, you have to discuss it under three headings. The first one is muscles involved in respiration. The second one is the change in the size and shape of thoracic cavity. And the last one is the pressures that are involved in respiration. So the first one we will be discussing is about the muscles of respiration. The muscles that helps in inspiration are called inspiratory muscles, and the primary inspiratory muscles are diaphragm and external intercostal, and the inspiratory accessory muscles are scalene, sternocleidomastoid, neck and back muscles, and muscles of upper respiratory tract. Similarly, the primary muscles that helps in expirations are internal intercostal muscles, and the respiratory accessory muscle includes abdominal muscles, neck and back muscles. Now, the second topic to be discussed under mechanics of respiration, as I've already mentioned, is a movement of thoracic cage. So the movement of thoracic cage is discussed under four headings. The first one is thoracic lid. The second one is upper costal series. The third one is lower costal series. And the final one is diaphragm. So what is this thoracic lid? Thoracic lid is formed by manubrium sterni and first pair of ribs. So whenever there occurs any movement in the thoracic lid, there will be increase in the anteroposterior diameter of the thoracic cage. So I repeat, thoracic lid is formed by manubrium sterni, which is the upper part of sternum, and first pair of ribs. The movement of thoracic lid increases the anteroposterior diameter of thoracic cage. Now, the next one is upper costal series. This is contributed by second to sixth pair of ribs. The movement of upper costal series increases the anteroposterior as well as transverse diameter of the thoracic cage. So this is explained with the help of two examples, and they are pump handle movement and bucket handle movement. Pump handle movement resembles the hand pump. That is, whenever there occurs any contraction of external intercostal muscle, it increases the anteroposterior diameter of the thoracic cage. The bucket hand movement increases the transverse diameter of thoracic cage. So how this movement occurs is described in next slide. Okay. Now, what is lower costal series? It is contributed by 7th to 10th pair of ribs, and their movement increases the transverse diameter of thoracic cage. As I've already mentioned, whenever there occurs an increase in the transverse diameter, it is explained with the help of bucket handle movement. And here also, it is explained with the help of bucket handle movement. Now, let's see how this movement occurs.
In the upper ribs, most of the movements occur at the anterior aspect. The costocartilage rotates upward, becoming more horizontal with inhalation. The movements of the ribs pushes the sternum anteriorly and superiorly. The increased movement of the sternum in relation to movement of the manubrium results in slight movement at the manubriosternal joint. The greatest effect that one can observe here to the motion of upper ribs and the sternum is the increase in the anteroposterior diameter of thorax. This combined ribs and sternal motion that occur in a sagittal plane is termed as pump handle motion of thorax. In the lower ribs, most of the movement occur at the lateral aspect. Structural wise, the lower ribs have more angle shape than the upper ribs, and they have an indirect attachment anteriorly to the sternum, which makes them to resemble a bucket handle. These factors allow the lower ribs more motion at the lateral aspect of the rib cage. The greatest change that one can observe here with the upward rotation and elevation of the lower ribs is the increase in transverse diameter of lower thorax. This motion of lower ribs that occur in a frontal plane is known as bucket handle motion of thorax.
So this is how the bucket handle as well as pump handle movement occurs. Now, diaphragm. As we know, the flattening of diaphragm increases the vertical diameter of the thoracic cage. So whenever the diaphragm contracts, the chest cavity enlarges, reducing the pressure inside it, and vice versa. So these are the movements of thoracic cage. Now, talking about the respiratory pressures, which is the third heading coming on the mechanics of respiration. The respiratory muscles are various pressures which exist in different structures in the thorax, and it includes two main pressures and their intrapleural and intraalveolar pressure. Intrapleural, the name itself suggests that it is a pressure that is located or that is present inside the pleural space. What is pleural space? That is the space between visceral and parietal layer. So the pressure that exists in the pleural cavity is called intrapleural pressure. Now, what is the cause for this? It is exerted by the suction of pleural fluid. It is due to the suctional effect of pleural fluid that this pressure is being generated. Now, talking about its normal value, it is normally negative. That is, during normal inspiration, it is more negative, and during expiration, it becomes less negative, though it is always negative. So, at the end of normal inspiration, it will be around -6 millimeter mercury, and at the end of normal expiration, it is around -2 millimeter mercury. Now, what is the significance of this pressure? Is it prevents the collapsing tendency of lungs, and it is also responsible for the venous return. So how is it responsible for the venous return? Because of this pressure, the vena cavas are getting elevated, and as a result, more blood is pumped against gravity into the vena cava and from vena cava into the right atrium. And that is how it is responsible for the venous return. Now, the next pressure is intraalveolar pressure. The name itself suggests it is a pressure that is located inside the alveoli. So it becomes negative during inspiration and positive during expiration. That is, during normal inspiration, it is -1 millimeter mercury, and during normal expiration, it will be +1 millimeter mercury. Now, the next one is transpulmonary pressure. That is, it is the pressure difference between intraalveolar and intrapleural pressure. And it is a measure of elastic force in the lungs, which is responsible for the collapsing tendency of lungs. So as a result, there are two major pressures, intrapleural and intraalveolar. Intrapleural pressure is the pressure that exists within the pleural space, and intraalveolar pressure is the pressure that is located within the alveoli. Now, these are the sequence of events that takes place during inspiration and expiration. During inspiration, there will be contraction of diaphragm. Whenever the diaphragm gets contracted, the thoracic cage gets expanded. As a result, intrapleural pressure becomes more negative, and there will be increase in transpulmonary pressure, which in turn results in the inflation of lungs. So whenever the lungs get inflated, the alveolar pressure is getting decreased, and therefore, because of this pressure difference, the air flows into the airway and lungs. As a result, there will be cessation of contraction of inspiratory muscle, which in turn ends inspiration. This is how the inspiration begins and terminates. Now let's see what are the sequence of events included in expiration. Whenever, so once the inspiratory muscles are getting cessated, there will be relaxation of inspiratory muscle. Once the inspiratory muscles gets relaxed, there will be dropping of rib cage. As a result, intrapleural pressure less negative, and we know that intrapleural pressure becomes less negative during expiration, and as a result, there will be decrease in the transpulmonary pressure. There will be deflation of the stretched lungs, or the size of the lungs will get decreased, and therefore the alveolar diameter is also getting reduced. Hence, the alveolar pressure becomes greater than that of atmospheric pressure. And because of this pressure difference, the air is pushed out of the lungs and finally expiration occurs. So this is how inspiration and expiration occurs during a normal respiratory cycle. So that is all about mechanics of respiration. And if it is asked as a question, then you have to describe it under three headings. The first one is which are the muscles involved in respiration. The second one you have to write is regarding the movements of thoracic cage. And the last one you have to mention about the pressure, that is intrapleural and intraalveolar pressure. So that is all about mechanics of respiration. I hope the concept is clear. Thank you.